Question. A 65-year-old female presents with a sudden-onset severe headache, confusion, and right-sided hemiparesis. A non-contrast head CT scan reveals a hyperdense middle cerebral artery, MCA, sign. What is the most likely diagnosis in this case? A. Subarachnoid hemorrhage. B. Ischemic stroke. C. Intracerebral hemorrhage. D. Transient ischemic attack, TIA. The most likely diagnosis in this case of a 65-year-old female presenting with a sudden-onset severe headache, confusion, and right-sided hemiparesis, along with a hyperdense middle cerebral artery, MCA, sign on a non-contrast head CT scan, is B. Ischemic stroke. The patient's clinical presentation, including the sudden-onset severe headache, confusion, right-sided hemiparesis, and the presence of a hyperdense middle cerebral artery, MCA, sign on CT scan, is highly indicative of an ischemic stroke. Here's the rationale for choosing this diagnosis. Sudden onset of neurological symptoms. The sudden onset of severe headache, confusion, and right-sided hemiparesis is characteristic of an acute neurological event, often seen in ischemic stroke. Hyperdense middle cerebral artery, MCA, sign. The presence of a hyperdense MCA sign on non-contrast CT scan is a radiographic indicator of thrombus or embolism in the MCA, suggesting an acute ischemic stroke. Options A, C, and D are less likely in this case. Subarachnoid hemorrhage, option A, would typically present with a different CT scan appearance, including subarachnoid blood in the basal cisterns, sulci, or fissures, rather than a hyperdense MCA sign. Intracerebral hemorrhage, option C, would also present differently on CT scan, with evidence of bleeding within the brain parenchyma, rather than the hyperdense MCA sign seen in ischemic stroke. Transient ischemic attack, TIA, option D, does not typically present with persistent neurological deficits and would not result in the hyperdense MCA sign observed on CT imaging. In summary, based on the patient's clinical presentation and the radiographic finding of a hyperdense MCA sign on CT scan, the most likely diagnosis is ischemic stroke. Urgent management and appropriate interventions are crucial in the acute phase of ischemic stroke. In summary, based on the patient's clinical presentation and the radiographic finding of a hyperdense MCA